Hi folks, I'm putting together a little video for one of my patients who's having a hard time and can't get in to see me for just a day or so, and this person has a sore neck. So here's the generic advice I give to a lot of my patients who have a sore neck. First, make sure you figure out why your neck is sore, because if you do something that takes the pain away but you don't know the cause of the pain, you might delay treatment of a serious irritation or a serious medical problem. What you want to do, if you're really sore, is to take the weight of your head off of your neck as often as you can. It might mean staying home from work if you're really sore, and it will mean lying on your side or on your back. So I've got a setup here, lots of pillows. I'm a big fan of pillows. When you're lying on your side, what you can do as a way to take the weight of your head off of your neck, if you have a curve in your waist, most people do, particularly females, you put a folded beach blanket or a towel, or folded beach blanket or a pillow that's kind of thin where the curve is probably going to be, with the thickest part at the apex of your curve. You select a number of pillows that are going to match the width of your shoulder on the one side of your neck, and you take the top pillow and you put it diagonally. And some people will take a small roll of towel and slip it in the pillowcase to make the bottom of the pillow a little thicker to match the narrow part of their neck. And some people will just take that pillow and they'll curl it under at the bottom edge to fill in that gap. So here is your first position of relaxation. And your head should be parallel to your torso, or maybe pushed away from the bed just a little bit. You can also simply experiment and have fewer pillows or more pillows until you find that position of your head that feels just great. I've got this little adjustable feature, so I'm going to use it. But you would have a few pillows on hand and maybe even some larger towels that you can use to fine-tune the thickness here. So I've got this bottom edge pulled up into my neck. I've got the weight of my head on my neck, the weight of my head on the pillow, and I'm just going to relax, maybe put on a relaxation track from the internet, or a breathing focus track on from the internet, whatever kind of dialogue makes you feel more relaxed, and I'm going to make the muscles of my neck as relaxed as possible. And I'll be here for as little as 5 minutes will help, but as long as 15 will also be very good. This is a position you can use when you sleep if you like. If you move around a lot, it won't last all night, but the portion of the night that you're in it will probably be helpful. You can further enhance your support by taking one of these long pillows and putting your arm and leg over top of it. Curl up like this, and then let the muscles of your neck relax by having the weight of your head supported by something passive, and let 5 to 15, 20 minutes pass. After you have done a position of relaxation, either this one or the other one that I like, which is lying face up, you're going to do a few gentle movements to cause the muscles that are excited and predisposed to spasming and jumping to calm down. Here's the lying on your back position. I've got a towel here. If you can't get down on the floor because perhaps you're a senior or something like that, these can be done on a bed, but if you can get down on the floor with a couple quilts on the floor, it's nice. It's a nice textured surface, right degree of firmness. This right here is going to occupy the space in the hollow of my back that's supposed to be here. This guy right here is going to be supporting my neck, and I'm going to get a stool or something. I'm going to put it on the surface I'm lying on, and that's going to I'm going to put my legs on there. Oops. So I'm going to fiddle with this until it feels like I have a nice relaxation position in my knees and my hips, and then my back will sit in a nice relaxed way. I'm going to put this a little lower and a little higher and just kind of fine-tune and adjust it until when I relax it feels like it's just in the right place. A little experiment. You may also have to experiment with the size of towel you use so you get the right dimension this way and this way in terms of thickness to match you. In terms of pillows, there'll be some experimenting required there too. If you have a back that's quite rounded and rigid, you'll need more space to occupy the space between the surface that you're lying on and the back of your head. If you have a flexible upper back, the space that needs to be occupied won't be as large, and you won't have to have as much material. So I'm going to take the bottom edge of the pillow, and I'm going to curl it a little bit, just enough so that the material that's in the pillow is bulked up to match the curve of my neck. And then I will simply relax here and do some deep breathing, or relaxed breathing, I should say. And let some time pass, feel the weight of my head against the pillow because my neck is relaxing and the pain in my neck is abating. And this is where you spend some time. Use the sideline position or this position, whichever you like. Once you're done, you're going to try to convince the muscles of your neck that movement can happen and not be painful. So what you're going to do is try some rotations. With the weight of your head on the pillow, rotate your neck in one direction and be conservative in how far you go. Go less far than you think you're capable of. And then let yourself come to the center again. And then do the other direction. Slow, cautious but not tense. Stop before you think you need to. And then once you're certain of the range that doesn't provoke irritation, you can expand it a degree or two with every repetition. So you're exploring the movement that is available and non-painful. And you'll discover your largest movement size that comes just to the edge of irritation in a more helpful way if you do it this way, as opposed to going really fast and far. You don't want to do that. So I'm going to pretend that the left side of my neck is irritated by turning to the left. So I'm exploring, and now I feel the beginnings of a little irritation. At this point, I'm not going to move any further, and I'm going to focus on relaxing. I'm going to feel the weight of my head against the pillow, and I'm going to relax, and hopefully that weight will become more pronounced, which will mean that my neck muscles are relaxing. And also, I'm hopeful that as that happens, the discomfort in my neck will also abate. I may encourage this by breathing softly a number of times while I'm in this position and focusing on relaxation. And you'll stay here so long as you're getting some success and a reduction in irritation. But you want to give it at least 5 to 10 seconds or 3 or 4 breaths to give it a chance to get used to it and a chance to calm down. If you're feeling, though, that you're getting some success, you can stay here for as many breaths as you find that relaxation is occurring. And then you can come out of the position when you've done a thorough job and achieved a good result, and then you can go in the opposite direction if it's uncomfortable. Now that I've gotten my rotation done, I'm going to sit up so I can show you better the other movements that are done. I'll sit sideways. Now what I'm going to do is I'm going to do what's called retraction. So most of the time we're like this. And sometimes we'll lose the ability to return here. If your neck is really sore, you may stop at the procedure when that ends when you're finished lying down. You may not do any more. If your neck is not quite so sore but in the way of your life, you may discover that these things can be done to increase your function. So I'm going to look straight ahead. And since my neck is pretending to be really sore, I'm going to put my head down a smidge. And then I'm going to leave my chest still, and I'm going to take my head back in space. And I'm going to discover the edge of sensitivity, like I did with the previous maneuver I just showed you. When I find that edge, I'm going to come to it, and I'm going to relax when I get there. Mentally focus on the area that's irritated, and try to get it to become less intense in its irritation. Give it a couple breaths to give it a good try. And if I'm getting somewhere, I'm going to stay here. And then I'll relax and maybe attempt this movement of my head back in space while my chin is down, perhaps 3, 4 times each session. Then I'm going to stretch the side of my neck or desensitize my neck to side bending. And let's say that my left side is the sensitive side. Put my hand on my head without my head moving away from the midline, and then ease my head over toward the right. This is here to guide, not to produce force. I'm going to go to the edge of that sensitivity and I'm going to use my focused relaxation like I showed you earlier. Pause the video now if you're doing this with me, and follow the procedure for as long as you need to get a good result. When you're done, just hit start again. I'm going to now do a different portion of my neck. So I'm going to turn my head about halfway rotated. I'm going to put my hand right up the center of my face, and my head's still perched on my shoulders appropriately. It's not bent in any direction, forward or backward now. And I will ease my head down forward, and I'm going to use my hands as a guiding force, but not a force to apply more tension through my neck. The weight of my head is going to do that plenty. Matter of fact, my arm and my hand may be a force that counters the dropping force of the weight of my head. Follow the procedure I mentioned to you before, and that's another portion of your neck that you've addressed. Make sure that when you're moving through your daily life, you do so deliberately. Make sure that your nose and toes are lined up. It's just a way to keep your head from being twisted on you. So if you want to see something and something to my left here, I'm going to turn my chest to face what I want to see. I'm not going to hold my neck necessarily rigid, but I'm going to try to be deliberate in what I do in day-to-day living so that the number of times that I rotate my head on my neck or move my head on my neck is maybe perhaps limited, doesn't occur to as large a extent or large an excursion, and it is deliberate. It is not like I hear a noise behind me and go like that, because that will set your progress back. When you're sitting, get a roll of towel or go buy one from a store, fancy roll for your back. Put it in the hollow of your back so your chest kind of stays up. And the size that you use should feel supportive, but not like somebody's got their fist in your back. Take some pillows and put them on your lap so that the weight of your arms, it goes through the pillow, and those muscles that go from your arms up into your neck are relaxed. And you will probably get better faster. Make sure you find out why your neck is sore in the first place, in case you have, well, the odds are against it, but the possibility exists that you might have a serious medical problem that's accounting for your pain, and doing these things is taking your pain away temporarily and maybe keeping you from seeing somebody like your doctor who would direct you to something that's very important for you at that time. And if you want to do this kind of rehab yourself, you're welcome to, but know that with every day you should have a noticeable trend of improvement. And within, in my experience, 3 days to a week, you should be feeling pretty much your normal self. If your condition is not responding in that way, you should partner with somebody so that your rehabilitation is comprehensive and your recovery is one that's going to last and is going to allow you to conduct your affairs in a predictable way without your neck kind of going out on you or having a weak recovery that isn't reliable. I hope this information has been helpful to you and wish you all the success in getting your neck better. Thanks.